Hi there, my name is Lerato. I'm a registered nurse and midwife currently working in the South African public healthcare system. Today I'm here to talk to you about your postpartum checkups. Now, postpartum checkups are very important. Many people forget that after the third trimester and the birth of the baby, there is what we call the fourth trimester, which is your postpartum period. Now, when should you go for your postpartum visits? So according to guidelines, you need to have a visit on day 3 post-delivery or within 72 hours, about 7 to 10 days after delivery, and the most important one, which is the 6-week checkup after delivery. So normally at your day 3 checkup, we'll be assessing your wound, we'll be assessing if your uterus is contracting well, if you're not bleeding. If you have a C-section wound, we'll check if it's healing, how you're managing with pain, supporting you with breastfeeding, and of course giving you the emotional support that you need, because this is a very difficult time with all the hormonal changes that are happening in a woman's body. It's also important for the baby. Most of the time when babies have physiological jaundice, it shows up within 72 hours. So that's why that visit is very important. The nurse or doctor will check the baby, make sure the cord is still well, make sure the baby is feeding well. They may weigh them, but normally within the first 3 days, the baby does lose a bit of weight, but it shouldn't be more than 10% of their body weight. After that, you'll come for your 7 to 10 day checkup. It's pretty much the same, except now we want to, if you are breastfeeding, we want to make sure you have enough supply and that baby is gaining weight. This is a very critical point where if you have any like foul smelling discharge or any distressed emotional state, that's very important in that checkup, because that's normally when we'll pick up if there's been an infection or if maybe you might be at risk for things like postpartum depression. And then lastly, there's your 6-week checkup. This is the most important one. Normally, this is where family planning is discussed, whatever family planning method you may have chosen, although you can start immediately after birth. What's very important, and I want to emphasize, is to make sure that you do your pap smear. A pap smear is always important after birth. This is to make sure that you're not at risk for cervical cancer and to just screen you for HPV so that we know how to prevent it further. And then we'll check the wound healing, your uterus, etc., your vital signs. And then the same for baby. This is when baby's development is checked. We'll check his weight. We'll make sure that they get their vaccines as well. So the 6-week visit is very important. In between, there are also like well baby visits where you'll go to weigh in baby, make sure he's feeding well, make sure he's developing well, etc. And then lastly, I just want to tell you that if you have any danger signs, which I'm going to list now, you don't have to wait for your appointment to contact your care provider. If you have severe bleeding with clots, a severe headache that doesn't resolve, especially if it's accompanied by blurry vision, if you have severe chest pain and coughing, if you have foul smelling discharge that's accompanied by fever, or if you have emotional distress that doesn't resolve within 2 weeks, you need to come to the nearest healthcare facility so that we can prevent further complications.